In this section, we're going to look at Chapter 15, Alterations in Blood Flow. Okay, we're going to start out with blood vessels. Okay, we have smooth muscle. So if you look down the barrel of a tube, okay, this would be the lumen. Okay, and if you were to look at this tube from the side, right, it would be a blood vessel, right? So there's three layers to a blood vessel. The insidemost layer is the tunica intima. The middle layer is the tunica media. And that is the smooth muscle layer. So blood vessels have the ability to open up with a big diameter, and then they have the ability to constrict to a smaller diameter. So this is vasodilation and vasoconstriction. Okay, in order to do this, they have to have receptors. So the blood vessels, which are smooth muscle, have androgenic receptors. Okay, and here is an example of that. Okay, so we have the nerves that can release norepinephrine. Okay, the nerves that can release norepinephrine, and they would go across and bind. So the norepinephrine would bind to the receptors on the postsynaptic membrane. Okay, and you have alpha receptors and you have beta receptors. Okay, in blood vessels supplying skeletal muscle, vascular smooth muscle has both alpha and beta receptors. Okay, alpha and beta adrenergic receptors. Okay, when an alpha is stimulated, it causes constriction. When an alpha is stimulated, it causes vasoconstriction. When a beta is stimulated, it causes vasodilation. As you can see, that tube is nice and open. Okay, this particular slide is showing you what happens when epinephrine binds with a beta receptor, a beta adrenergic receptor. Okay, and that does activate cyclic AMP, okay, which behaves as a second messenger and causes a whole bunch of cascade of events. So ATP is used, cyclic AMP is used, and an example, because it's epinephrine, can be to increase heart rate, and can help break down glycogen to glucose. Okay, in order to release epinephrine and norepinephrine, okay, you have to be in the sympathetic nervous system, or simply put, stress, okay, which is your sympathetics. All right, and that releases your epinephrine, norepinephrine. And so if you're under stress, then yes, it would elevate heart rate, can elevate blood pressure. Okay, it can make you sweat. Digestive function tends to decline when you are in sympathetics. Because remember, parasympathetics is rest and digest. So if you're in sympathetics, your digestive system would not went to work very well. Okay, arteries have more receptors than veins. So they can vasoconstrict at a greater rate. Okay, arteries can vasoconstrict at a greater rate than veins. With intrinsic blood flow, internal organs do well maintaining a constant blood flow, irrespective of vasoconstriction or vasodilation. Okay, this is all under autoregulation. The precapillary sphincters aid in this intrinsic blood flow. NO, which stands for nitric oxide, helps with vasodilation. Okay, so when nitric oxide is activated, then it will help open up the tubes. As you can see here, the lumen is nice and open. It's dilated, so vasodilation. Okay, a thrombus is a stationary blood clot is considered a pathological condition. It forms from the activation of platelets, clotting factors, fibrin, and inflammation. Okay, all of these adhere to the blood vessel wall. Okay, they become very sticky and adhere to the blood vessel wall. So first you need an injury, okay, you need damage. Then the body activates the platelet plug or coagulation mechanisms. So the platelets get sticky, and eventually the fibrin network is formed and starts to form a clot. Okay, here's another picture of what a clot would look like. A thrombus can hit an artery or a vein. Okay, if it hits the artery, then you're going to get decrease in flow, increase in turbulence, okay, this risks the clot to enlarge. And eventually artery occlusion. Okay, so it would, so here's your nice open lumen with nothing in it, as it should be, no clots or anything. And an occlusion would be because the clot started to fill the entire lumen, so that would be occlusion. Okay, in the vein side, it would cause a decrease in metabolic waste. Okay, and this leads to edema. Okay, you can get vein swelling. Okay, this is called phlebitis. And then you can get a thromboemboli. phlebitis. An example is a DVT, or deep vein thrombosis. Okay, treatment. If this is from sedentary lifestyle, then exercise. Okay, or some sort of movement, because circulation is key to, or is one of the things that can help prevent blood clots. Okay, the more sedentary you are, the higher your chances of blood clots. Okay, stop smoking. Hydrate. If side effects of medication, then reevaluate and hopefully get off the meds that are causing the problems, or at least decrease the meds. There is some strategy behind that. As you can imagine, some people, their medications are mismanaged. People just call in to get their prescriptions filled. And at some point in life, they just don't even know why they're taking this stuff anymore. They just do it. Okay, so I'm just saying sometimes it's mismanaged. So it's okay to reevaluate their medications. Okay, an example would be oral contraceptives, as they can cause blood clots. Okay, if from trauma, then patient care. Okay, due to the natural course of aging, there's ways to prevent with diet and lifestyle. Okay, so to prevent a thrombus with diet and lifestyle. So, examples would be to take your essential fatty acids like omega-3, diet and lifestyle, anti-inflammatory diet can help. If from poor nutrition, then improve their diet. Okay, an embolus is a thrombus that breaks free. Okay, so right here you can see so we're looking inside of a blood vessel tube, and you can see the plaque formation. Okay, so all that yellow stuff there, they're trying to show as plaque. And what that has done, it has narrowed the lumen. Okay, so as this particular embolus is traveling around, because of the size of the embolus, the diameter happens to meet the diameter of the now narrow opening because of the plaque formation, then it can get stuck. Okay, now when that happens, you're going to get a drastic decrease in oxygen because of decreased blood flow. And then that means the tissue from this point on will die. Okay, so this can cause damage to the brain, to the heart, and to the lungs. Okay, if the damage is in the brain, then that is a stroke. If the damage is in the heart, that can lead to a myocardial infarction, which is a fancy word for heart attack. And if in the lungs, it can cause a pulmonary embolism. So treatment would be to remove the emboli. You can add a green field filter in the inferior vena cava. Okay, the IVC there is the inferior vena cava. And this picture here is showing you the what the greenfield filter looks like that they put in the inferior vena cava below the renal veins. Okay, this is inserted below the renal veins. And then you're supposed to remove the filter after about 3 months. Otherwise, after that, you risk the filter permanently adhering itself to the wall of the inferior vena cava. Plus, you want to get all those blood clot things out of there. And then also with treatment, you can do blood thinners. Okay, here is a X-ray of the greenfield filter. Okay, you can see the here's a picture of it there. Okay, aneurysms. Another thing that can alter blood flow. Aneurysms are localized dilation of an artery. Can alter blood flow. Okay, so an aneurysm does balloon out. Okay, it does balloon out and it risks rupturing. And of course, if it ruptures, you're going to get bleeding into the area that it ruptures, such as the brain. Okay, if this ruptures, it can hurt the brain tissue in that particular area. Okay, vein vulvar incompetence is a busted valve in the vein. Okay, varicose veins can result from this, can cause hypoxia to tissue at the hurt area, can lead to ulcers in the hurt area. So in a healthy vein, you've got the one-way valves which prevent backflow, but in a diseased vein, those one-way valves do not have the ability to close, so blood not only works its way toward the heart, but it also works backwards, causing the veins to enlarge. And this increases pressure within the veins, and this can be the look in a person, basically a sign and symptom. Okay, complications and symptoms include swelling in the lower legs and ankles, especially after extended periods of standing. Achy or tiredness in the legs. They can develop new varicose veins. Okay, the skin can look leathery over time, flaking or itching skin on the legs or feet, and they can get stasis ulcers or venous stasis ulcers. Okay, diagnosis is to do a vascular or duplex ultrasound that may be used to examine the blood circulation, plus the patient history and visual exam. Treatment is to avoid long periods of standing or sitting. If you must take a long trip and will be sitting for a long time, you can do things like flex and extend your legs, your feet and ankles about 10 times every 30 minutes to keep the blood flowing. You can also stand up. Like for example, if you're on a flight, like get up and move around. Or if you're sitting in a seminar or whatever, work, just get up and move around. I have my patients set an alarm on their phone to alert themselves every 30 minutes and encourage them to not ignore it. Or if you have one of those smartwatches, these days those smartwatches will alert you after 30 minutes or 60 minutes of not moving around. Okay, so sitting for too long. And you can tell the smartwatch at what time it should alert you if you've been sitting for too long. You can usually customize the time. So like for example on mine, I have it set for 45 minutes. So if I've been sitting for 45 minutes, it will alarm and alert me and basically says, get up and get moving. Okay, you can exercise regularly. Weight loss can help. Elevating your legs can help. Wear compression socks. Okay, this one is another big one I usually have my patients purchase. They're not expensive and they work wonderfully. They have compression socks or stockings that can go up to your calf like a regular sock, or it can go actually all the way up from the foot all the way up to the top of the thigh. Okay, so the entire leg. Okay, antibiotics if there's a skin infection or any other kind of infection, and then practice good skin hygiene. Okay, this one is here just more for your for extra reading. I'll go over a couple things. So non-surgical treatments include sclerotherapy and endovenous thermal ablation. This is a common one I'll refer out for if I'm dealing with a person with pretty significant damaged veins. Okay, the sclerotherapy involves injection of a solution directly into the spider veins or small varicose veins that causes them to collapse and disappear. The ablation is using a laser to basically go in and heat up the vein and it kind of burns it out. Okay, so it'll close up the vein and basically render it ineffective. Okay, on the surgery end, they can do a ligation or stripping. You can do an ambulatory phlebectomy, so just simply remove the vein, or a vein bypass. Okay, arteriovenous fistulas, or AVF. This is abnormal communication between an artery and a vein. Symptoms include red, swollen skin, purplish blood vessels, bulging veins that can be seen through the skin. The treatment depends on the severity. Some AV fistulas close without treatment. Others may require surgery or a procedure to reroute blood flow. So this can be done as a congenital anomaly, which means the body just did it on its own. Okay, where you have the artery that has this abnormal communication with a vein. Okay, so that would be the fistula. You can also do it surgically. All right. Here is an example of what it looks like if a person has an AV fistula. Okay, you can also do this surgically. Usually this is an AV fistula is done on purpose if a person needs dialysis. So you have the congenital version and you have the surgery version, which meaning they actually made a fistula for you. Okay, arteriosclerosis. Okay, so the word itself, arterio, and then sclerosis, means hardening of an artery. Okay, so the thickening and hardening and the loss of elasticity of the walls of the arteries. keep in mind a blood vessel needs to have the ability to constrict itself and dilate itself and then go back, right? So there's an elastic property. This process gradually decreases the blood flow to one's organs and tissues and can lead to severe health risks brought on by the atherosclerosis, which is a specific form of arteriosclerosis. So the atherosclerosis is caused by fatty plaque buildup because cholesterol, more specifically the LDLs, which become oxidized, can turn into foam cells, and all that is activated because of inflammation and inflammatory mediators. So this is brought on by smoking, bad diet, or genetic factors and other diet and lifestyle factors. Okay, atherosclerosis, here is the so-called plaque formation. Okay, atherosclerosis is the primary cause of coronary artery disease, also known as CAD, and stroke with multiple genetic and environmental contributions. The signs and symptoms of arteriosclerosis depend on the vessels that are affected by the disease. If affecting cerebral or ophthalmic vessels, as in cerebrovascular accidents, or TIAs, transient ischemic attack, signs and symptoms may include sudden weakness, facial or lower limb numbness, confusion, difficulty understanding speech, and problems seeing. So in other words, stroke-like signs and symptoms. If affecting coronary vessels, as in the coronary artery disease, including acute myocardial ischemia or a heart attack, signs and symptoms may include chest pain, pain in the jaw, the arm, primarily the left arm, back pain, shortness of breath, crushing chest pain. Okay, they may also say, feels like an elephant is sitting on my chest. Okay, the pathophysiology of this is the lesion of the arteriosclerosis begin with the tunica intima, okay, that is the innermost layer on the blood vessel wall. Okay, they are linked through common features such as stiffening of the arterial vessels, thickening of the arterial walls, and degenerative nature of the disease. Okay, the artery can also become calcified. Okay, so what ends up happening is the tunica intima, which you're seeing that layer here. Okay, the next layer is the tunica media, which is the muscle layer, and then the outsidemost layer is the tunica adventitia. All right, so the first thing that you need to do is be in some sort of chronic injury, some sort of chronic inflammation, chronic problem, okay, such as hyperlipidemia, hypertension, smoking, homocysteine, hemodynamic factors, toxins, viruses, immune reactions, okay, and anything else that can simply cause inflammation to your blood vessels. What also helps is to have nutritional deficiencies. Okay, that's very helpful. To lack your essential fatty acids, vitamin D, vitamin E, all your fat soluble vitamins. Avoid your fruits and vegetables and all the micronutrients that come with that. You know, avoid clean proteins and avoid staying hydrated. The usual suspects. People wake up in the morning and they pretty much say, how can I destroy my blood vessels today? And then they think about it and then they do it. And that all falls under diet and lifestyle stuff. Now, an exception to that is genetics. Genetics you can't help, but it's also not helpful to combine the genetics with poor diet and lifestyle choices. Okay. So then the body's response to injury. So we have an injury right here. So you get a crack, tear, or fissure in the tunica intima. The body goes, okay, there's damage to the tunica intima. I can fix that. So it activates inflammation, and when you activate inflammation, you're going to bring in inflammatory mediators, you're going to bring in your white blood cells, you're going to bring in platelets, you increase the permeability, so you get leukocyte adhesions, monocyte adhesions. Okay, the area just gets sticky and it starts to patch itself. And if you'll notice, it does this underneath the tunica intima, in between the tunica intima and the tunica media. So now we're on the way to narrowing the lumen. Okay, and the third part of this, just simply continue to do your thing. Continue to smoke and stay dehydrated and all the poor diet and lifestyle choices. And as time goes by, it continues to thicken that layer between the tunica intima and the tunica media. And then you get the activation of the LDLs, which turn into foam cells because they're oxidized, and you start to get the fatty streaks, and you get the collagen formation, which is also your scar tissue. Okay, and the process continues, and the process continues. And more proliferation, more collagen, and the white blood cells and other inflammatory mediator things continue to do their thing. More lipid is deposited, and the process just simply continues over time. So our in a way, culturally speaking, they kind of pick on cholesterol. Oh, you have high cholesterol, and so let's put you on statin medications. Okay, well, how about let's look at the inflammatory processes. Okay, let's look at the inflammatory processes that are likely damaging the blood vessels and look for nutritional deficiencies. And when you fix these, you can help drastically reduce the damage that the blood vessels are experiencing. Okay, smoking damage like cigarette smoking damage, you get what's called superoxide ions are formed. Smoking causes a decrease in the nitric oxide and an increase in what's called endothelin. Okay, this is a peptide. Okay, endothelin is a peptide that causes vasoconstriction. Vasoconstriction causes an increase in blood pressure and accelerates cardiovascular heart disease. Okay, accelerates cardiovascular heart disease and accelerates thrombosis. Okay, the nicotine that's found in cigarettes, along with the carbon monoxide, these will increase your LDLs and triglycerides. They will decrease your HDLs, which is considered the good cholesterol because it helps lower the LDLs. It causes vasospasms. It increases platelet aggregation. And it decreases oxygen supply to tissue, which is a form of hypoxia or ischemia. Okay, active and passive smoking, I'm supposed to say smoking, active and passive smoking are damaging. Okay, active means the person is actually puffing on the cigarette. Passive is alluding to second-hand smoke. Okay, smoking increases chances of cardiovascular disease by 4 times. Okay, other risk factors that can enhance smoking damage. Okay, so in other words, things that are not helpful would be obesity, diabetes, glucose intolerance, the number of cigarettes per day. Okay, so obviously there's a difference between a person having 1 cigarette a day and 2 packs a day. And the length of time smoking. Have they been smoking for 1 year, for 10 years, for 40 years? Okay, signs and symptoms and disease associated with atherosclerosis. You can get renal disease, cardiac disease, the pad or peripheral arterial disease, and stroke. Okay, studies or the exam that you can do. You can do Doppler ultrasound, looking for blood flow. Okay, you can do blood pressure in upper and lower extremity. You can run them through a stress test, do an angiograph. Okay, treatment would be to stop smoking, do your diet and lifestyle modifications, and there's a wide range of eating clean and improving diet and lifestyle. Weight loss, angioplasty, a stent, and bypass surgery if they need to that level of care, okay, which would be surgery. Okay, Raynaud's syndrome is an increase in vasoconstriction, and a decrease in blood flow. All right, they can become, the tissue can become pale or cyanotic, followed by reactive hyperemia, which means it goes from pale and cyanotic to red and flush looking. Okay, it's more prevalent in women than men, and there is a genetic predisposition. Provocative factors for Raynaud's would be stress can make it worse, cold temperatures can make it worse, smoking and sedentary lifestyle, and also some nutritional deficiencies. Okay, medications such as calcium channel blockers can help, anti-hypertension medications. They can also supplement with potassium iodine, nitric oxide, which is your L-citrulline and L-arginine. And the one that I like is by a company called Phoenix, or spelled FNX. Okay, that's the company name. And the product is called L-arginine. And the ingredients within it, they're going to have the L-citrulline, the L-arginine, and a bunch of other stuff. And you basically just take a scoop a day, and it gets the ingredients in your body to help produce the nitric oxide. And remember, nitric oxide causes vasodilation. Okay, it can help open up the tubes. Okay, I've had really good success putting people on this particular formula. Okay, here is a picture of what Raynaud's would look like in a person with the pale followed by a red flush look. Okay, there's a pale look, and they can even be cyanotic or blue. Okay, acute arterial occlusion. Okay, the word acute should give it away that it's happening now. This is synonymous with acute limb ischemia. Ischemia is the deprivation of oxygen to tissue and is considered a vascular emergency. Acute limb ischemia is defined as sudden decrease of limb perfusion for up to 2 weeks after the initiating event. Acute arterial occlusion can occur at any peripheral artery of the upper and lower extremities, and you can experience profound ischemia. As a result, gangrene and sepsis can set in. So this is the risk if untreated. Okay, causes of acute arterial occlusion can be things like a thrombus, an emboli, or compartment syndrome. Compartment syndrome is where the leg or whatever body part starts to swell so much that it's going to choke off the blood flow, and tissue can die. Okay, signs and symptoms would be pallor, which is pale, paresthesia, paralysis, pain, polar, and pulselessness. Okay, these are the classic 6 P's that come with the acute arterial occlusion. Okay, treatment would be to get perfusion going right away. So do it stat or right away or immediately. Okay, otherwise necrosis due to ischemia can set in. You would want to give anticoagulants, remove the thrombus or emboli, and then if no treatment, it can lead to amputation. Okay, here's an example of that. Okay, where you have the clot or the thrombus that will get stuck and block blood flow. So from that point on, there is nothing, and tissue can start to die. Okay, here's an example of what a person's limb can look like when experiencing acute arterial occlusion. Okay, lymphedema. This is where lymph flow is obstructed. Okay, edema is alluding to swelling. So the lymph vessels behave like veins. Okay, and what that means is they have one-way valves. They work toward the heart, okay, as far as circulation, and it requires movement to circulate, just like the veins do. Okay, causes for lymphedema can be filarial worms, which is a parasite. Post-op, such as breast cancer or any cancer treatment, especially when they remove tissue. So there's no cure, but can be managed. So things like diet and lifestyle, exercise, okay, compression socks can help. And here's what it would look like. So you certainly get swelling of the leg with lymphedema.